essentially when Pete and I first spoke about this, we realised that there was probably a gap for people in regional areas about being able to access this sort of training. There are some sort of courses and what have you, but there's not a whole lot. So essentially we could spend hours and hours doing taping tonight. Now you're not going to do that because I'm not going to stay here for 5 or 6 hours, and you sure as hell aren't either. What we're going to do is we're going to cover 2 topics. And the idea being that we don't rush on them, but we get through them and you get the info you need and hopefully walk out of the door going, that's great, now I know what I can do for this injury or for that part, and now I've got a better understanding. Some of you may already know what we're going to present, but hopefully again that rehashes for you and you might learn something new as well as we go. So, just a little bit about me. I don't like talking about myself, but I'm going to for 2 seconds, so bear with me. The head trainer in Myo at the Richmond Footy Club. I've been there since 2008. Prior to that, I was at the Melbourne Footy Club. I spent some time, 4 or 5 years at North Ballarat in the VFL before that. I've worked with various sporting groups and elite athletes. I've worked in private practice, and I've presented at various seminars and conferences. So what I'm saying is hopefully I've got enough experience to pass on to you guys tonight that you'll get something out of it. First question, I'm only going to ask you a few, I promise. Why did you come tonight? Because I know Pete said to see me, but that wasn't the case. That's not... Sorry? Go for it, raise your hand. Yeah.
Well, for your lesson come because we play for the Gisborne women's football team. And
Yep.
we wanted to learn more about strapping up our injuries, also being able to prevent them from each other.
Yep, great. Anything else?
There are 5 of us here from Bunningham Football Club, so all trainers there basically just want to make sure that we're all on par with what we're doing, make sure it's supporting the club.
Yeah, great. And what we'll show you tonight, like I said, might be something you already know, but it's what we're doing at the elite level right now. What I will say when we get into the actual taping is, what we show you tonight, if you came back in 12 months, it might not be quite the same because of ongoing research and evidence, and we try and change things up a little bit. Anyone else? Yeah.
Youth girls footy, Dickens Grant was playing, dodgy ankle, wanting to find out, seeing the girls, a lot of juniors strapped up like mummies, thinking that, wow, they take them, go to one, and that's going to hold them together. And some of it just doesn't look right. So
Yep.
that's what they're
Great.
further.
And this stuff, on that point, strapped up like mummies, it's not the cheapest product in the world, tape, is it? As you all probably know, we don't have an unlimited budget. I don't even have an unlimited budget. I'll spend more than probably what you guys will, but, sorry Andrew, yes I do, because I buy all these tape. But what we're going to show you tonight is some techniques to use where you use less tape. You might use a little bit more than what you're using, but it should give you a good indication. But also the difference about using a quality product and how important maybe spending that extra couple of dollars on a roll of tape is versus something that can be really cheap and nasty, because it does make a difference. Anyone else? Yeah.
Mixed up with Ballarat Bulldogs and Ballarat Swans girls
Yep.
side, and yeah, just no one really knows how to strap anyone properly, so yeah, that was a bit fun.
Well, fingers crossed we can teach you something. Rightio. What we do is we might move on. Now, I don't mind slides, but I don't really like them. So I reckon for the whole presentation there might be half a dozen of them. The rest is all going to be discussion and demoing and you guys actually having a go at stuff. So before we undertake any form of taping, there's a few key points that we need to worry about. Why are we taping? What are we taping? How are we going to do it? And what products we need. Is that 4 key points you reckon that would sum up any form of taping, those who've done it before? Yeah? And they're really important that we know why we're doing it and how we're doing it and what we're doing it for. Because you can actually cause further injury or more injury if you don't actually do it correctly in the first place. This is not an ad for Victor Sport, although it might seem like it. So the key products here, and we're going to run through these very quickly. Does everyone know the different names for different tapes? No? Some might not. This is what we call rigid tape, and it comes in various sizes. This one is the sort of standard size that everyone will use, and it's a 38mm. There is a bigger one, a 50mm. and also goes down in size as well. Now, depending on what joint you're taping, will depend on what size you use. But your standard, if you're only going to buy one type, buy the 38mm one. The next point here, this stuff here, this is called Fix. It's a hypoallergenic underwrap. And there's a few reasons why we tend to use this quite a lot. One is tape sticks better to tape rather than tape does just to skin. As I said, it's hypoallergenic, so there's a less chance of irritation to the skin as well with that underneath, and can help prevent things like tape cuts and rubbing and blisters and bits and pieces. There's a whole range of other stuff. We've got our, what we call our EAB, or elastic adhesive bandage, or stretch tape, as you might commonly know it. That's really good for wrapping around joints as well, over the top of your rigid tape if you need more support. That stuff can only be cut with scissors, you can't tear it, as opposed to the rigid tape, which can be torn by hand. This one here, it's a bit sticky, is a hand tearable or a blood tape. Have you guys heard it called blood tape before? Yeah. It's great. It can be used from a compression point of view. It can overwrap rigid tape. It can go underneath. And the beauty of it is it rips really easy. So you don't even have to think about it. So if you're wrapping someone really quickly, and it might be in a footy sense or a sporting sense on the field, we can use that really quickly and not have to worry about pulling out scissors and cutting it. And then obviously your scissors, tape scissors. Is it okay to use any other form of scissors, you reckon? Like ones out of the kitchen or ones off the desk? I ask this question when I do these things and you'll be surprised at the answers. No. Any idea why? Yeah. So they've got that little knobbly bit on the end. And so you can slide it down underneath tape and in between skin, and you generally won't cut people. Generally. It has happened. Any questions on any of that? Andrew will probably talk through his products a little bit more at the end. And you'll be able to have a look at it, and Pete's definitely got some here as well that we'll talk about. The one thing I will say is that it's a bit of a coincidence that you're here tonight anyway, but at Richmond we use Victor, and we've used the other brands in the past, and this is not a sell, but for mine, when you use these products every day, all day, every day, you're going to go for the best, particularly when you're trying to limit injuries on hundreds of thousands of dollars worth of cattle. So we go with the best product that's out there at any given time, and at this point that's Victor, and that's why we go with them. So in a sense, you guys are probably pretty lucky, because tonight you're getting to use the best stuff to practice with and hopefully take away with you as well. Any questions on that? I've just gone the wrong way. I'll turn it upside down. Righto. A couple of slides on theory and then we're into it. There are a few key things that we also need to know when we start taping. So before we apply any sort of tape whatsoever, we need to prepare the skin. There's a few things there that we need to worry about. So if the athlete is shaving for taping, in a sense, so whether it's their ankles or whatever it may be, ideally that's done 24 hours prior. And the only reason that that's done 24 hours prior in an ideal world is that because of the adhesive and the skin's irritated, it can actually create a fair bit of irritation with the tape itself if you do it straight away. This is a bit textbook, isn't it? Clean the area of the skin that's to be taped by using a tape removing solution or alcohol swab. Hands up if you do that, guys who do taping now. Do you clean the skin every time you tape? I'm not putting my hand up because I don't. The only reason I would say that is if you've got massage oil or cream or something like that, then you probably should do it because the tape won't stick. Cover any broken skin or rashes, again, because the tape can make that a little bit worse. Any idea what you could put over if you've got a little cut or broken skin to stop it getting irritated by the rigid tape, for example, if we're doing an ankle?
Just a bit of blood tape.
Yeah, you could do blood tape, or again, the Fix. It's really handy for that sort of stuff. The Fix. So that's a Fix 100, and there's a Fix 50, which is just the width of it. So it's 50mm versus 100mm. And then, what if you've got someone who you haven't taped before? There's a really key criteria here, because some people are allergic to zinc oxide, which is the adhesive in tape. If I've got someone who've never taped before, the first thing I'll do is get them in a little bit earlier if you can, and then just put it behind their knee or in their elbow, just a patch of it. just like so. Leave it for 5-10 minutes and then take it off. And if it's really red or they're saying it's starting to get itchy or hot or irritated, then they're probably allergic to the zinc oxide, at which point you go and see Andrew and get your hypoallergenic rigid, which is different again, which we actually use with one of our boys too at the moment. So that's one thing you need to worry about. Rightio, how tight should it be? Give me an answer on that. How tight does the tape need to be? Any idea? Bang. For all that riding, all you need to worry about is circulation or capillary refill at the end of the extremity. So if it's an ankle, tape it. If it starts to go purple straight away, or they talk about pins and needles, it's probably too tight, so you need to get it off. If you're not sure, you can just pinch the end of the nail, a toenail or fingernail. Obviously it goes white, wait for it to go back to pink, count that period of time, 2 to 3 seconds the average. Don't be alarmed if it's 6 or 7 seconds, check the side you haven't taped first, because some people have a different rate of capillary refill or that blood flowing back into the limb. But that's an easy way to do it. Sometimes the athlete will say it feels too tight, but we all know that for those who've done it before, get them out, let them run around and warm up, and they'll probably then be okay with it as well. How much do we use? It will depend on how much support you want to provide to that particular joint or that area as to how much you're going to use. My biggest thing with taping, and has been for a long time, and can you block your ears because you don't like this, even though we buy a lot from you, is that you try and use the least amount of tape possible. Anyone got an idea why I would say that?
Sure.
And it's not that, well, it's cheaper, but it's not the point. Yeah.
The player won't then rely on the support of the tape.
Yeah, you can always, in my mind, you can always add more. Like if they get off and go, oh, yeah, I might need a little bit more, you can add another one. But it's much harder to then take something off once you've put it on with tape. You almost have to cut it off and start again. So there is a cost effect to it, but also you don't want them to become reliant on it every single time. If you use too much, as that last point says, the joint and surrounding musculature become immobile and you get your blood flow issues and all that sort of stuff. And then how long can we leave this on, or when should we take it off? As soon as possible? Yep, fair call. Time frame? Is there a time frame you think that we should not go past with having this on the skin?
1 full day.
1 full day? Yeah, yeah. I would like to say that it's no longer than 24 hours, but in reality, it's probably 4 or 5, 6 at a push, I would have thought.
Depending on the tape.
Depending on the
zinc
tape.
oxide adhesive, we wouldn't leave it for more than 5-6 hours.
Yeah, yeah. Now the difference is, and I've got in my hand here, is the kinesio tape, which we're not, or K-tape, we're not going to really cover tonight, but you can have a chat about later. That can stay on for several days.
It's
Yeah.
acrylic adhesive, so anything that's not zinc oxide can actually stay on for 4 or 5 days.
But the difference is, this is for supporting joints. This won't support an ankle if you tape it with an ankle from an injury prevention point of view. Rightio. We're in. Okay, so what we're going to cover tonight is 2 subjects. We're going to start with the lower extremity. So we're going to go ankles and knees. Now they're probably 2 of the most common ones that you're going to have to do a lot of the time. So that was why we thought we'd go with that. Hopefully you'll walk away and go, geez, that was really good. I wouldn't mind learning a bit more. And I think, and don't quote me, but I think Pete's got a second date in line where we might then move on to shoulders and things like that as well. Okay, so who's taped an ankle before? About half? Great. There will be variances in how you tape to how you tape to how I tape. But at the end of the day, as long as we're on the same page in terms of the mechanism that we're trying to limit or the movement we're trying to limit or prevent, and then what injury we're trying to prevent, we'll be okay. So in a lot of sports, the ankle's placed under excessive load. More than you would even consider, really. And it's one of the joints that gets injured a hell of a lot in a lot of sports. It can be footy, it can be netball, it can be basketball, cricket, anything. The most common type in a footy sense and most sports is what we call an inversion sprain. Does anyone know what I mean when I say an inversion sprain? Yeah, the simplest way to describe it, ankle turns in. So that's where, if you imagine this is the base of my foot, it does this, which we've all probably done. You could have done it anywhere, walking down the stairs, doing something, you've just gone over on it and bounced back up. Now, half the time you'll go over it and bounce back up and it's okay, but then sometimes it's not. Now, without you all walking away and going, every time you roll your ankle, you damage this ligament that I'm about to talk about, because it does happen a lot, probably 90% of the time, but it's not always the case. So don't take it as gospel. But a ligament that gets injured a hell of a lot is called the ATFL. And we'll use abbreviations because it's much easier than pronouncing all of it. Okay, so that happens when we go or we invert on our foot or our ankle, stretches this ligament here on the outside and can cause various degree of injury. So it can be just some stretching of the fibres, it can be partial tearing of the fibres, or it can be a complete rupture of the fibres. Now, in a lot of cases, you get some fibres torn and some overstretching. That's your typical ankle injury, where you get a bit of swelling. If you imagine that bone on the outside of your ankle, that lateral malleolus, just in front of that is where this ligament's located. So you get that sort of bulge of swelling and maybe a bit of bruising. You've seen that before? So the taping we're going to do is to help prevent that inversion movement, which in turn is the causative effect when you do that on that ligament. What we need to do is think about what movement it is, what are we trying, that movement we're trying to limit or stop, and then how we use our tape to do that. So, we're going to demo it, we're going to talk through it as we go, and then you guys in groups can have a go at it and we'll walk around and have a discussion. Does that sound okay to you? Yeah. Before we get into the demo, is there any questions about this and about what we're about to do? Yeah?
When you were saying about the swelling and bruising, is that on one particular side of the ankle?
It's generally on the lateral aspect or the outside. Yeah, outside. However, it can be on the medial side as well, because if you imagine that, and some of you may not be able to see this, so the ligament is here, the ATFL, which is at the front of that bony or that lateral malleolus. What happens is that as you invert, that ligament gets stretched. But what also happens on the inside is you get some jamming of the bony structures as well. So that's why you can end up being sore or getting bruising on the inside when you've injured the outside. And it's one of those conundrums that people go, but I hurt this side, why is this side sore and bruised? And that's why, because it jams up on the other side with the impact. Answer your question? Yeah, okay.